The internet is full of bro science, fake knowledge, half information, or propaganda. Your quest of reliable, authentic health information ends here. So subscribe this channel and hit the bell icon, and you never have to go anywhere else ever again.
Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, we make videos about health and healthcare topics and all are referenced from US National Medical Library, so they are authentic and you can trust them. We are talking about blood tests and it's a series. We have already made videos about complete hemogram, complete blood test, why you can have high number of CBCs, total leukocyte, TLC, WBCs, high number of RBCs or low RBCs. Now we are going to talk about why you can have low WBCs, low white blood cells, low lymphocytes, leukocytes, that is basically leukopenia. Leukocyte is WBC and one of the cells in WBCs which are lymphocytes. So we have 5 different types of cells in WBCs. They are neutrophils, lymphocytes, basophils, then monocytes and eosinophils. So all these cells have a different role here and they can vary. So if these whole total number of WBCs are very less, then there can be a number of things in your body. Number one, we're not going to talk about the most common one. We are just going to enlist the reasons, right? One of the reasons here is liver damage. Yes, any reason why your liver is damaged, maybe because of overuse of alcohol, right? Or any major liver disease can actually lead to decreased number of WBCs, right? Then there is spleen. Any spleen disorder. Spleen is again another organ which is present in the left side of your upper abdomen. So there also you can have a problem, and that's why your spleen can actually get enlarged, right? If you have enlarged spleen, it might lead to it might be a sign that you might have lower than normal WBC counts, right? Because what happens if there are abnormal WBCs, if they are damaged WBCs, if they are having any issues, right, then the spleen actually takes these cells and sequesters them. It takes them and recycles them. Basically it basically takes them out of the of the blood, so spleen gets enlarged, right? So then bone marrow is a place where you actually where all these blood cells are formed. So if bone marrow has an issue, maybe if there is a tumor or infection in the bone marrow, maybe you had a cancer and you took radiation and chemotherapy, any kind of treatment for cancer or even cancer in the bone marrow can lead to decreased number of these cells in the formation of these cells are decreased in the bone marrow, or abnormal cells are produced which are again going to the spleen, right, for destruction. So these are the reasons why you can have them decreased number. Again, autoimmune diseases like SLE, systemic lupus erythematosus, right, HIV AIDS or other autoimmune diseases where your immunity is compromised, again that is because of reduced WBC. WBCs are your fighting cells, right? So infections, usually infections with bacteria will cause a spike in your WBC count, but some infections like viruses like HIV and mononucleosis, they can even reduce your WBC count. So viruses, infections are one of the reasons. Lastly, medicines. Yes, medicines can have side effects on your bone marrow. They can suppress your bone marrow and reduce all the blood cells in your blood. So they can also contribute to the problem. Remember, whenever there is a problem, something like this is these conditions are diagnosed on the basis of your signs, on your symptoms, on the whole overall presentation of a patient. So you need to go to a physician if you have any abnormalities in your WBCs or your CBC, complete hemo, or any blood test, and they will help you get better and even find out what is going on in your body, right? So this is all about a lower than normal WBC. Thank you so much for watching. Stay connected and stay healthy, my friends.